Hey Guru Nation, it feels like I'm so far away right now. It's probably the last couple of videos I'm actually filming in this particular office. Some of you might remember the couch with the big picture of Orange County and the beach behind me. So we're actually moving upstairs, all right? We're moving on up, moving upstairs at this research clinic that I'm at in Irvine, a bigger space. And so different settings, different backdrop. But yeah, one of the last videos I'll probably do in this room, right? But we're not going anywhere. We're going upstairs. So today, the way it works is pretty easy actually. You can call or text me, 949-415-6256. You can also email me like this person did, dan@theclinicaltrialsguru.com. Or you can reach out by any social network that you feel comfortable with, all right? I've been pushing Instagram a lot. I'm trying to build my Instagram platform. It's probably my weakest platform, and I'm trying to build it up. So, because I think it's going to be one of the most important in 2017. So, send me your questions. I'll keep you anonymous. This one's going to be anonymous. So, some of the identifying info I have to leave out, but you'll get the general context of the question, all right? So, I started as a clinical, and this is the question, okay? I started as a clinical research coordinator. Then he gives a little bit about his background, got a bachelor's degree, worked 4 years in public health research, worked for an IRB, did some phase 1 work. So he's worked with like large organizations, government institutions, academic institutions, big hospitals, like companies that when they do research, everything has a system, right? Like you don't just come in, like at this clinic where I'm at right now, okay, it's a tiny clinic. If you are the study coordinator here, which Monica is now, many of you know Monica from the videos, you're literally asked to do everything. And we have SOPs, we have trainings, but there's really no system. You are the system, and that's because we're a startup. As we grow, you know, I've built my previous company, South Coast Clinical Trials, from just me to 8 people, and then we quickly expanded to a little over a dozen because we opened up 2 other clinics. So I had systems there, but it took like 8 years to get to that point, okay? We've since sold that site, and we've started these other ones. So, this is kind of the general gist of this person's question. Is his whole career he's been working at these big institutions. They have systems in place, very structured, right? Now he's at a place, a private clinic, probably similar to my own, where he's asked to do everything as the study coordinator. The previous coordinator left, and there's no training, so let me read. There is no coordinator training here, no research team. There are 5 studies. The doctors expect me to learn the ins and outs of all the trials. The site does not even have SOPs, so in this case it's different than my site. We have SOPs, okay. The coordinator is responsible for training the nursing staff, creating source docs, everything for up to 4 to 5 trials with one coordinator. So, and then he just goes on. So as a new coordinator, and just to summarize now, as a new coordinator, I feel the training is inadequate here, and I'm hesitant to conduct any research at this site without adequate training and resources. Do you have any advice for myself or the site? So the advice I have is, this is kind of the norm for these small research clinics. Now, just like every coin has 2 sides, they actually have 3 sides. They have heads, tails, and then the edge, alright? But for the purpose of this metaphor, there's a good and bad to this entire situation. The good is, because of all these responsibilities that are, quite frankly, been handed to you, you are now going to have experience within a year, you're going to have experience with everything, like things that they would have never dreamed of giving you at these larger institutions, like training staff, right? Like this is like management type stuff, like director level stuff, which, of course, there's a lot of cons to this. You have to be the right personality for that. Like, if you're not up for that challenge, it's probably not for you. You're probably better off at your old work environment, or a work environment similar to that. And by the way, there's no right or wrong. It's really, what kind of person are you? What's your personality? Can you handle this? There's cons. There's pros and cons to both, right? The pros at your old organization was everything structured, systematic. The cons could be, for someone like me, that'd be very boring, right? I wouldn't be able to really expand my skills, right? Because if I'm asked to do just data entry, or just create source docs, or just like do quality assurance on the studies, like, then I'm not doing all this other stuff. And I wouldn't do well in that kind of environment. Now you might, and again, there's nothing wrong with that. In your current environment, that would be much more conducive to my type of personality. Now, there's cons there as well, right? Like, you may feel extremely overwhelmed at times. You may feel like you don't have support, and that's because, quite honestly, and I've been in many of these situations, the doctors, the PIs, who, by the way, are 100% responsible for the conduct of these studies at their sites where they're the PIs for, they're not necessarily going to care about research until they start seeing research producing a profit for them, right? Like, in many of these small clinics, the research department, which is usually in a hybrid of a PI's private practice, and then they have like a research department, which is like one person, like yourself, or like me. I've been in this situation. You're treated like the ugly stepchild, right? Until you start making money for them. But guess what? Guess what the pros are? If you're able to pull that off, and again, there's no right or wrong, like, if you don't fit in this kind of environment, you shouldn't be in it. But if you're up for that challenge, a lot can go right for you. Like, you can start getting profit sharing. You can even ask for a percentage of the company. You will now be equipped to start your own clinic one day, or work for another startup, or partner with another doctor, and use this as a reference for your resume and say, look what I've done here. I've taken over this brand new startup research department. I've increased profits X%. The doctor went from not making any money to making this much money. I know how to do everything that it takes to accomplish that, and I can do it with you. Like, that's incredible. You would never get that opportunity in your previous job. So the real answer to your question is, unfortunately, this is the norm. And in many cases with study coordinators, unfortunately, they're put in an environment where they're not the right fit for that situation. Like a startup company, any industry, right? But we're talking about clinical research sites right now. A startup company, especially startup research clinic, it takes a certain kind of personality to be the employee and basically running the show there. In your case, you're like the one-man show. You have a PI, but they're not really doing much. So it's really up to you to turn it around. Or, you can go work at a different kind of place where maybe you're a better fit for that type of environment. So that's the answer to the question, is really, what kind of personality do you have? Do you think you're suitable for this environment? Or did you feel better at your other environment? And again, don't feel bad just because you may have a different personality than I do. I would be, like I said, I would be horrible. I would feel awful in a very rigid, structured environment. And in a startup environment, I feel free. Like, that's where I thrive. So wherever you can fit in is where you need to be. And you don't know what you like until you try it. So I would suggest continue there for a few more months. You may like it, you may not, you may hate it, and then you go back to your previous job, or you go back to an organization similar to that one, or you accept your situation for what it is, you see the opportunity, you like it. I want you to actually like where you're working, and then just go all in, right? Those are the options you have. Hopefully this helps. Thank you very much for watching Guru Nation, and I'll talk to you soon.